Let's talk about the organic and inorganic components of blood plasma. Before we get into plasma, let's discuss the difference between organic and inorganic compounds. Organic compounds are mainly compounds that contain carbon and hydrogen bonds. Opposed to that, inorganic compounds don't usually contain carbon. Of course, there are exceptions to these because inorganic carbon compounds do exist, including carbon dioxide, some carbonates, etc. But if you'll notice, these usually don't have a carbon and hydrogen bond. Now that we know this, let's proceed. Let's look at the blood composition. When we have whole blood that's being, drawn out or you see it, it doesn't look like this. That's because to assess the components, this blood has been centrifugated, right? The one in the picture. So plasma actually makes up about 55% of total blood volume. Then you have a buffy coat which will contain some cells like platelets, leukocytes, etc. And then you have the red blood cells which are making up about 45% of total blood volume, and that is also known as your hematocrit. If we really look into plasma as a standalone component, you will see that it's made up of 90 to 91% of water, 7 to 8% of proteins, and then of some other inorganic compounds like electrolytes, sometimes respiratory gases, nutrients, metabolic wastes, and some regulatory substances like hormones, vitamins, enzymes, neurotransmitters, etc. Another important thing is that plasma acts as a suspension for red and white blood cells as well as platelets. So mainly all your cells are being suspended in this fluid that is plasma. Some important functions, as you can see here, of plasma proteins include oncotic pressure, which is also known as colloid osmotic pressure, and all proteins, but mainly albumin, will help retain water inside the vessels for body fluid regulation. Then they are also acting as transport proteins, as we will also see further, but albumin definitely does that function. You also have a reserve in forms of amino acids if the cell needs it, and they also can bind H plus ions, which will play a role in pH balance. Additionally, there are some specific functions too, and I will tell you with examples. Blood coagulation, for example, clotting factors such as fibrinogen, they help us prevent excessive blood loss. Then there is the humoral immunity, which will be in form of the antibodies from plasma cells, which will bind antigens and mark them. And then we also have inflammatory processes like the acute phase proteins that are generated during an inflammation. Widely speaking, plasma proteins are classified based on two systems. One is based on their molecular weight, and including in this we have the albumins, globulins, and fibrinogens. And functionally speaking as well, we have the proteolytic enzymes, protease inhibitors, carrier proteins, as well as your acute phase proteins. So let's look at this in a little bit more detail. Firstly, based on molecular weight classification, I would like to tell you that albumin is the lightest, globulins come somewhere in between, and then fibrinogen is the heaviest out of them all. Now let's talk specifically about each of them. Albumin, it's the most abundant plasma protein, and it accounts for almost 60% of all the proteins. And one of its important functions is to maintain oncotic pressure. It also acts as a transport protein like we just spoke about, and it's mainly doing that for low water solubility molecules such as your fatty acids, bile salts, bilirubin, cortisol, etc. It also has a function of buffering. Then you have globulins, which have different classes, including the alpha, beta, or gamma globulins, and the alpha and beta globulins mainly play a role as transport proteins. And then your gamma globulins, which are the immunoglobulins, IgG, A, M, E, and D, they are secreted by plasma cells and will help with immunity. And then you have fibrinogen, which is clotting factor number 1. It's made by the liver and it participates in the clotting cascade, and it's polymerized by thrombin into insoluble fibrin, which of course helps with clotting. And plasma without fibrinogen is called serum, just something to keep in mind. Now we have a functional classification. Let's talk first about acute phase proteins. C-reactive protein is a marker of inflammation. What they do is they bind to the membrane of injured cells and mark them for phagocytosis, or they will then activate the complement system. You also have serum amyloid A proteins, which bind to bacteria and inhibit their functions. They also mainly work by releasing cytokines. Then you have proteins of the clotting cascade, like fibrinogen that we just spoke about. Let's talk now about the system of plasma proteolytic enzymes. They are enzymes that can activate signaling molecules, and the systems that these are made of consist the complement system, the kinin system, some factors of hemocoagulation, and so on. Let's talk now about the system of plasma protease inhibitors. They inhibit plasma proteolytic enzymes, as we can see from the name, and they need regulation because we have to work with them really precisely. And now lastly, the carrier proteins, albumin, which we have talked about. Not a specific carrier, but it can carry all those previously mentioned molecules, which are not water soluble completely. Then you have the apolipoproteins, which actually make up the protein part of lipoproteins, and they help in carrying the different molecules. Lipoproteins help carry TAGs, cholesterol, phospholipids, and so on, as you will learn in biochem. And if you're wondering what LDL stands for, it's low density lipoproteins. There are many classes actually of lipoproteins, as you will see, and this is one of them. And then you have transferrin, which acts as a transporting protein for iron. And yeah, that's the functional classification. Now let's talk about that inorganic portion that we were speaking about, and that is the concentration of electrolytes in plasma. These values that you see here are good because they're mostly in a range, and that's how physiology professors like to hear it. If you see different values in different sources, that's okay. They're usually pretty similar, and these are pretty accurate. But mainly in the plasma, you will find sodium, potassium, calcium, bicarbonate, and phosphate. And if you remember, plasma is actually a part of the extracellular fluid along with your interstitial fluid. So to some extent, ECF will have a similar concentration like the electrolytes in the plasma, if that makes sense. Once we're done with this, blood plasma will also consist of a few things like oxygen and carbon dioxide, dissolved form, of course. Then you will have some nutrients like glucose, amino acids, fatty acids, because they're being transported in the blood plasma. You'll also have metabolic waste like carbon dioxide, lactic acid, uric acid, which is going to different organs. And then you will have some regulatory substances like we spoke about before, but that is the tiny 2% of which makes up the blood plasma, and the rest of it we have spoken about in some detail right now.